Alrighty, good afternoon, everyone, and thank you for joining us this afternoon. My name is PJ Prunty. I'm the President and CEO of the Greater Danbury Chamber of Commerce. I'd like to thank you for joining us. We are honored today to have Dr. Perera. Dr. Perera is the founder of Contemporary Care, a facility based in Danbury and Greenwich. Dr. Perera, thank you very much for taking time out of your day and joining us. How are you and your family holding up over these past 2.5 months?
Thank you for having me. And family is doing well. Everyone's staying safe. We're being pretty strict about quarantining, and everyone's doing fine right now. It's me, my wife, my son who just graduated from college, and my daughter is in the city, staying safe.
Excellent. I'm glad to hear that. And for those that are joining us, you're encouraged to submit a question through the chat box. If you would like to pose one to Dr. Perera, just feel free to use the feature located down at the bottom of the screen there. So, Dr. Perera, let's hop right into it here. I understand in your earlier days of your studies, you were deciding between neurology and psychiatry. Why did you choose psychiatry versus neurology?
Well, one of the I think both are great fields, and both have to do with the brain, and the brain is the final frontier in our understanding of the human body, and it's really the most intelligent thing in the universe. But having said that, at the time that I was deciding, with neurology, you were able to diagnose very, very precisely. So if you had a stroke or something that is going on, you could have a lot of precision in diagnosing where the problem was. But unfortunately, there was not much that you could do because some of the neurological problems were permanent or degenerating without ability to reverse it. At that time, psychiatry was still a black box. We didn't really understand much of what was going on or how things were happening as much as we do today. But there were a lot of interventions that could actually change somebody's life and help somebody. So because psychiatry has the ability with its treatments to change a person's life, but not only a person's life, but also when somebody is suffering, their family suffers as well. So there's a ripple effect that's going on around them. And to be able to make a big change in both that person and their whole family and friends was very meaningful to me. And that's why I decided to choose psychiatry.
The final frontier. I like that analogy. So have you seen many changes in the past 20 years of practicing, and what do you feel as though the future looks like for your industry?
Right. So I was involved in a lot of research at Columbia. And one of the areas that we found that was very interesting was that the brain can make new neurons. So the idea that the brain is born with a certain set of neurons and that was all we had is no longer true. The brain can actually repair itself, and in the emotional part of the brain, increased neuron formation or neurogenesis is associated with happiness and resilience, and decreased neurogenesis is associated with depression and anxiety disorders, etc. So the fact that the brain can generate new neurons and these new neurons can have an impact on our emotional behavior is a big change that has happened in the last 20 years. The other area that is becoming increasingly interesting is through functional brain imaging, that is called fMRI and PET scans, etc. We can see the mind at work. So a traditional MRI will just show only the brain and the structures of the brain. But with the fMRI, we can see which brain cells and brain circuits are firing when we're sad, happy, laughing, in love, etc. And based on the firing patterns of those neurons, we can actually read somebody's mind. We can know what exactly they're thinking and how they're thinking about it. And related to this, we can see the disorders in their thinking patterns and try to fix them through things like TMS and magnetic treatment. We can try to fix the abnormal firing in people who have depression, anxiety, schizophrenia, etc. So this ability to actually see the brain and how it's firing when we're thinking, and how to alter when people are suffering from thoughts is another development over the last 20 years that's made a big change. And then the future, obviously, is where we will look at genes as well, and controlling genes and trying to see if that can also make a difference both in neurological and psychiatric disorders.
Correct me if I'm wrong. I think you were featured on Dr. Oz's show for TMS. Did I see that? Am I making that up, or was that?
That's true. That's true. I was on Dr. Oz about TMS, and we were able to get a machine in there. We had a patient in there. We showed how the treatment works, how it impacts somebody's life, and we were also able to show some of the neurophysics involved in the treatment.
Excellent. That was a nice segment that I saw. So something I've been reading in the newspapers and the news on TV is the mental health aspect of this pandemic, and frankly, the stressors that have come about due to COVID-19, whether it be financial stress, family stress, the potential of grieving of a lost one, either due to COVID-19 or other work stress, and the stress about the virus as well. What high-level advice would you give to those out there dealing with these stressors currently in their life? I realize this could be a whole.
The first thing to
Go ahead. Sorry.
Sorry.
No, I said I realize that's sort of a loaded question, but just your take on that.
Right. I mean, the first thing to realize is the most common thing I'm seeing with this problem is anxiety and worry. And the first thing to realize is that it's very normal to feel this way. Because, like three things that are going on right now. One is our fear of getting ill and dying. This is a very lethal disorder. It's 20 times more lethal than the flu. And unfortunately, we are at the epicenter. New York and its suburbs are the epicenter not only of the country, but of the world. And sadly, many of us know people who have died. And it happens very, very quickly. So trying to stay safe from this unseen enemy is very, very, it's a very scary proposition. So that's one. The second is the economic aspect of it. A lot of people are struggling. A lot of people are worried about losing their jobs. Others have lost their jobs. They're wondering how to make ends meet. And the financial stress of that is a very real worry. And so feeling anxious and stressed about that also makes a lot of sense. And then the third is, with the quarantining, we have a lot more time on our hands. So more time to think, more time to worry, more time to ruminate, because one of the ways to avoid worry is by staying busy, but we don't have the luxury of doing that. We can make, opportunities for ourselves to stay busy. So that's the one aspect of this very real pandemic where we have more control over. And so those are the three main reasons for worrying, and worrying in this situation is very real. And we should not try to run away from it. There are people who are drinking more or doing drugs, and trying to avoid worrying when it's very real, it leads to these kind of behaviors that can cause secondary problems.
Sure, that's well said. Great response on that one, Doctor. Again, anyone who's participating, feel free to use the chat box to submit a question, and we'll try to get it into the queue here. So a lot of we've been hearing around the medical field is telehealth, right? So can you explain to us exactly what is telehealth, and why is it important to behavioral health, and who can benefit from it?
So telehealth is where we would electronically see the patient from afar. I mean, that's sort of the definition I can give it right now. And essentially what it means is that patients can be staying at home, staying at work, wherever they are, and through the computer or through a mobile device, see their doctor who is either working from home or working in the office. And now that is obviously a very important aspect of delivering health at a time like this. Now, when it comes to mental health, telehealth lends itself very well, because in terms of other health fields where you need physical involvement, you need to do a physical exam, etc. With mental health, there's very little physical involvement. It's not zero. You have to still, check blood pressure in people, etc. But for most people, telehealth is a possibility because it involves talking. What we do, a lot of what we do involves talking, and we have now the technology to do that without being in the same room together.
How will telehealth, you think, impact the future of medical practice? Do you see this as something being a long-term and potentially permanent, avenue? I mean, this obviously has existed pre-COVID, but do you think this is going to be sort of the new normal, if you will, in the medical industry?
Yes, I think it is. The one thing that was preventing us from doing this, to be very honest, was the restrictions placed by Medicare and by the insurance companies. Otherwise, it's almost a natural way of treating patients. Sure. In this day and age. So there are several advantages to telehealth, and some of them are very obvious. The first thing is you don't have to travel, right? I mean, traveling can take up to an hour each way just for a 15-minute appointment. So not being able to travel for people who are not that mobile, they don't have to take time off if they can't leave the house. They don't have to get babysitting. They don't have to take time off from work, etc. So that gives us a huge advantage in terms of being able to see patients. The second would be outreach. There are lots of areas in this country, and certainly even in New England, in this region, that are rural, where the patients don't have access to specialists. In fact, in rural areas, there are only like 43 specialists for like every 100,000 people. So here you can actually see somebody, far away from your state, but now with the new Medicare sort of loosening their restrictions, you can see people in different states. So I have patients who want to see someone who has like expertise in TMS or ketamine or depression, which are really my areas of expertise. And people from all over, from Massachusetts, from New Jersey, from, you name it, from different states, they can reach out to me, make an appointment, and see me. So that's a huge advantage in having this greater reach. Sure. For patients. And so those are the sort of two other big advantages. And what we found is that 74% of patients who use telehealth like it, prefer it over actual meeting. A third one, obviously, the reason why we're doing this is the risk of infections. Whenever you go to a doctor's office or a hospital, you're going to get infected. Forget about COVID-19. When there's a flu season going on, you're going to get infected. So that kind of exposure that you can have to other people is not going to happen. And moving forward in the future, fear of infection is always going to be an issue for us. Right. This COVID-19 crisis is going to leave an indelible mark in our lifetime. And so a lot of people will feel more comfortable if they don't have to be present around in a busy waiting room, etc. There are other minor things. One of the interesting things is we always have to be on time. For telehealth, you have a specific appointment. So, this idea, doctors are notorious for keeping their patients waiting, but they can't do that anymore with telehealth. So that's another nice benefit that the patients tend to enjoy. So those are some of the important positives. The negatives would be obviously technology. Whenever you're depending on technology, you're trying to get on Facebook today, you said it's 50-50. Right. Like that, you're going to have problems. Sometimes people can get on their device. It doesn't work for reasons that are always mysterious when there's so much technology involved. People need to have technology at home to be able to do this, and not everyone does. Especially the elderly population are not familiar with computers and getting on. getting onto the video side, linking onto the video side, etc., can be an issue. So technology has to improve further to make things easier, and it has to be more uniformly distributed. Getting paperwork in is a difficulty. So whenever we have new patients, we need to have them fill out questionnaire paperwork. A lot of people have difficulty doing that and faxing it over, and that becomes something very stressful for them to do. And we don't have the physical ability to obviously do labs or to do to check weight and things like that. And not being present in person gives us less information. So for instance, if somebody is drinking a lot, we get the breath of alcohol, the smell of alcohol we would have that without being seen in person. And the other drawback to a lesser extent is there are some patients, one more drawback, obviously privacy issues. So we want to make sure that there are no hackers getting in here and listening in on the conversations. And another one that I am seeing with some patients is that while they don't mind seeing the psychiatrist and doing the medication management, etc., sometimes doing therapy is not the same as when you're sitting in the room with a person. So some patients will tell me, a lot of patients say, I'm fine doing this. I'm fine even doing groups. But there are a lot who say it's not quite the same thing. Another example of this is AA. Now, AA is doing all their meetings through Zoom. Zoom is not the safest method of doing this because of hackers, and it's not quite the same. So we give up something to get something. There's never a free lunch. But overall, the impression is that it has been quite beneficial. It's also cost saving. It's cost saving for the patients because they don't have to travel. It's cost saving for the psychiatrists, the therapists, and the mental health practitioners because they don't need to have the same level of overhead. And as long as the insurance companies are willing to allow this to happen, it'll be the wave of the future.
Sure. And how does insurance handle telehealth, and does Contemporary Care take insurance to that?
Yeah, so we take all insurances, including Medicare, and right now they are allowed, all insurance companies, they follow whatever Medicare tells them that they can do. So right now, universally, all insurance companies are covering telehealth, and we are taking all insurances. Now, in the future, if there are going to be restrictions, we will have to change the pattern. But I'm hoping that this is a change that is permanent because it makes so much sense. It's so beneficial for so many people at a much wider scale that, in fact, the number of hospitalizations for one study went down by 34% because patients can have much more frequent appointments with their doctors. So the ER visits and hospitalizations went down. So if insurance companies look from an economic standpoint, it makes sense for them to do this because it's saving them money, saving them hospitalizations as well, allowing us to see patients not just within our state, but even outside our state, because psychiatry is a specialized field. It's not readily available in many, many areas. There's a lot of places that are short-served, not just in psychiatry, but also in medical health. And having telehealth widely available will allow us to access many more areas than we normally do.
That makes sense. So how long have you has your practice been in Danbury now?
So my father-in-law started the practice in the 1970s. So he was practicing for about 40 years in Danbury. I took over the practice about 3 years ago, and we've been practicing. So basically, the practice as it stands has been around for about 40 odd years. And then we have a practice in Greenwich, which I started, which has been going on for about 10 years. And then we've been doing TMS also for the last 10 years. We've actually do more TMS than any other practice in the country. And we also do ketamine more than any other practice in the region.
So what would you, as the leader at Contemporary Care, what would you say would be one of the most important principles that you try to demonstrate and instill into your team's approach when working with patients?
So in your question, you had the answer. It's a team approach. So we want to, it has to be a comprehensive approach. So when a patient comes to us, there are two things that are going on. One is we need to find out what's going on with the patient, but then the second thing is we need to present with the patient with all the options available. Something that's unspoken and unheard, and unfortunately is that if you don't have all the solutions to the patient, you won't offer them, and the patient will never know they're there, right? So if you have a patient who's struggling with medications, nothing is working, we have other options. We have obviously things like ketamine and TMS we can offer. The second thing is it has to also, so having lots of different solutions to a patient's problem is important. The second thing is having multiple modes of treating a patient is very important. So if a patient comes to our practice, we have a comprehensive approach. We do the assessment, but we also provide therapy, provide groups. So you come to one place where everyone's talking to each other, working as a team, and you get all the different types, couples therapy, all that in one place. You don't have to go to 3 different providers who are not talking to each other, who are providing 3 different types of treatment, and some of the treatment can be contradictory to what somebody is trying to offer.
I just had a question come in through the chat group. Can TMS and ketamine be used together?
Yes, that's an interesting question, and the answer is yes. You can. Somebody can do both the TMS and the ketamine at the same time, and there have been some early preliminary studies showing the benefit of doing both together.
So I know you briefly talked about TMS earlier on, but can you give sort of a high-level description as to what TMS and ketamine are and why they're what are they used for to treat?
Right. So TMS is used if antidepressants are not working. So if you've tried 3 to 4 different antidepressants, and if they're not working for depression, then TMS can be used. It's effective in other disorders as well, but insurance will only cover for depression. And basically what TMS involves is a neuromagnetic pulse. It's electrical neuromagnetic pulse that stimulates the part of the brain that's underactive in depression. So you sit in a chair, you bring this coil over your head, you feel a tapping sensation. And what it's doing is, based on fMRI scans, we know that the left front part of the brain, which is important for pleasure and enjoyment, etc., is under firing. It's not firing well. And when you normalize the firing, whether through medications, therapy, electroshock therapy, people get better. So knowing that, now we use TMS to stimulate that area directly, whereas all the other treatments we have are very imprecise. Medications go all over the body, all over the brain, but TMS only targets the area that's involved in depression, and you do it 5 days a week for up to 6 weeks. And people after about 3 weeks start feeling better, and in about 6 or 7 weeks get completely better. So people who fail medications have a 70% chance of getting better with TMS. And because they're very precise and only target that region of the brain, it's very, very safe. The only people who can do TMS are people with magnetic metal implants. But other than that, anyone else can do TMS. There's no systemic side effects. We've treated children as young as 6, adults as old as 101, and we've had very good results. And now every single insurance company, including Medicare, will cover it if you've tried between 2 to 4 antidepressants. So that's the story with TMS. It's an excellent option. Rather than going in circles with medication, you can think about that. It also works for other disorders like anxiety disorders, OCD, social phobia, generalized anxiety, even bipolar depression, but those are considered off-label applications of TMS. So, but still, they in the future, most disorders that we have will eventually become approved for TMS treatment. Then we have ketamine. So ketamine is given 2 different ways. It's given intravenously or it's given intranasally. And what you do is you come into the office, you have to spend a couple of hours there because the ketamine can make you drowsy and a little bit dissociative. So you get your ketamine treatment, you do it twice a week for the first 2 to 3 weeks, and then you do once a week thereafter, and it helps with depression. It also has been shown to help with chronic pain And most recently, for people who are acutely suicidal and doing very poorly, it helps very quickly. Difference with ketamine is that you will see the improvements within 24 hours.
Okay.
You get somebody better, so you can prevent people from having to go into the hospital, etc. But then you have to keep treating to maintain those benefits over a period of time. And that also has now been FDA approved and is covered by insurance, the intranasal part of it. And so we do that just as frequently as we do the TMS. And it's a great option in addition to everything else we have in helping patients.
Thanks. I appreciate elaborating on those two methods. Is there anything else you'd like to say for our conversation today? Looks like we're just about ready to wrap up for today. Any other last comments?
No, I think I think we really enjoy helping the Danbury community, and we have like sometimes even whole families coming and getting different treaters and treatments, etc. And we treat all disorders, not just depression and bipolar, anxiety, schizophrenia, ADD, drug abuse, eating disorders, etc. So we have an excellent team of very experienced and knowledgeable therapists and providers and clinicians who can offer a lot of benefit to a lot of people.
Excellent. Well, Dr. Perera, thank you again for your time and your insight today. Very relevant and worthwhile information. So I appreciate all your work and your dedication to our community. I'm sorry, we had just one question come in. If someone wants an appointment, how do they get in touch is the question.
So our phone number is 203-792-0400. It's 203-792-0400. You call that number for any of our offices. We have office here in Danbury, one in Greenwich, and TMS offices in Fairfield, Manhattan, and Long Island. And they can set up an appointment calling that number, 203-792-0400.
Thank you. And then your information is on our chamber website as well. For those that are looking to get in contact with you and your team. So thank you once again. I appreciate taking the time out. For those who are able to join us today, thank you. We will be hosting Dan Bertram. Dan is the principal of BRT Properties here in Danbury, BRT Companies, on Friday at 1 p.m. So we look forward to chatting with Dan. Thank you everyone for joining us. Dr. Perera, my best to you and your family. Stay healthy and stay well. Thank you.
Thank you. You too, to your family as well.
Thank you.
Bye.